talking about the reference centers in sarcoma, I think it's a very important issue because in some countries in Europe, for instance, in the Scandinavian countries, there is, by law, there is decided how many centers will be able to manage patients with the suspicion of sarcoma in each country. In Denmark, in Sweden, in Norway, in each country, the government has decided what kind of cancer are able to manage this kind of patients. So this is important, and by law since 1980s. So it's very striking this long time, but they have a registry, population-based registry, and they can test each year, each 5 years, how they can improve the results of the patients. And this is very important because the centralization entails benefits in terms of local control, in terms even in overall survival. So this is very important. And in Spain, the problem is we have 17 different health systems within our country. And I think in the last 5 years we have worked together different societies in charge of diagnosis of treatment of sarcoma patients, and we have shared the need to the health ministry about these reference centers. So finally the ministry, the health ministry had the sensitivity to hear us and to put in action this CESUR. CESUR means in Spanish Center of Services and Units of Reference. So we have defined the minimum requirements of the quality for apply as CESUR, and now we are in the final part of this process, and hopefully the ministry will determine what kind of centers will be CESUR. So the health ministry is thinking about 6 centers in Spain. And this is very important because sarcoma is the only tumor for which the normal sequence of first diagnosis and then treatment is inversed, because in many times the patient undergo to an unplanned surgery, and then the pathologist said this is a sarcoma, and then is sent to medical oncologist. A medical oncologist has to order all the puzzle of the disease, and this is the completely inverse sequence of events. So it should be nice to first diagnose through core biopsy, and then to plan multidisciplinarily the treatment for the patient. And this is only possible if reference is a fact, is a matter of fact. So we are waiting for this kind of centralization in a country where dispersion is very normal. So this is important, and we, all the community, all the societies around sarcoma patients are really waiting for this reality.